Welcome to our language learning series tailored for busy medical professionals. So in today's video, we'll be focusing on, and these are the goals for the video, singular personal pronouns in Spanish and how to address unfamiliar individuals in a respectful manner. So let's dive right in, shall we? Here we go. We're going to start with the singular personal pronouns of yo, tú, and of course usted, él, and ella. Now, to give you an example, let's just start with yo. Yo is mainly used when referring to ourselves in a sentence. So, to give you an example, yo soy médico or doctor. I am a doctor. Yo trabajo en el hospital means I work in the hospital. So, this is the most fundamental piece of information that you need to master in Spanish. Yo, which is I. Yo soy doctor, yo soy médico. I'll give you the definition of these two terms in a later video, but for now, you can use them interchangeably. Yo trabajo en el hospital, and let me also give you more examples. This is a table of yo that comes in handy. Yo soy el doctor, I am the doctor. You can also use yo soy la doctora if you're a female doctor. I am the doctor, female. Yo soy su doctor, I am your doctor. Yo soy el enfermero, yo soy la enfermera, yo soy su enfermero, I am your nurse, or enfermera if it's a female nurse. Yo trabajo en el hospital, yo le voy a ayudar, I am going to help you. Yo soy parte de su equipo, I am part of your team. Very important table. If you can screenshot it, memorize it, it's going to come in handy quite often. Now, next we have the second person singular pronouns of tú and usted. Now, for tú and usted, in Latin America, just remember that we usually use usted to address unfamiliar individuals in a respectful manner. However, when talking to older patients, we often use señor or señora, as you can see right here. Señor is Spanish for Mr. Señora is Spanish for Mrs. You can use these in all health facilities where you're treating older patients. So instead of using tú or usted, you can address older patients as señor or señora, followed by their last names. Now, it is also often very common to hear don and doña. Don't worry about this too much. For now, just think that it means the same as señor or señora, although technically this is gentleman and lady. But that's for another video. For now, just stick to señor and señora if it makes it easier for you. Give you an example, quick example. How are you feeling today? You can say, ¿Cómo se siente usted? How are you feeling? ¿Cómo se siente usted? Of course, the usted covers the you part. Okay. Now, to incorporate a señor and señora, we can go up here and we can say, ¿Cómo está, señor? And then followed by the last name. ¿Cómo está, señora? And followed by the last name as well. This is the Spanish form of how are you doing, Mr.? Last name, how are you doing, Mrs.? And then last name. Just remember that using the appropriate form of address shows respect and establishes a positive rapport with patients. Very useful information. So let me give you more examples of the Mr. and Mrs. in Spanish and English. So these are phrases that you can use either with Mr. or Mrs. Very useful. You can say, Señor or señora, tenemos buenas noticias. Mr., Mrs., we have good news. Señor, señora, tenemos malas noticias. Señor, señora, se podrá ir a casa. You can go home. Señor, señora, sígame por favor. Please follow me. Señor, señora, siéntese aquí por favor. Señor, señora, Espere aquí, por favor. Please wait here. These are very useful, so make sure you memorize them, print them out, put them as wallpaper. Very useful information. So now let's explore some medical examples to better understand how these pronouns are used in a healthcare setting. Let me give you an example of él and ella. When discussing a patient with a family member per se, él tiene fiebre is an example. He has a fever. Or ella tiene dolor de cabeza. She has a headache. You know, the ella tiene dolor de cabeza can be used when mom is describing daughter symptoms or mom symptoms. If it's an older patient, ella tiene dolor de cabeza. She has a headache. Or maybe you're saying it when explaining it to a family member. You know, ella tiene dolor de cabeza. So very useful to know this and master the he and she in Spanish. And I also have a table that's helpful using the appropriate personal pronoun to help clarify the subject of the sentence and ensures the effective communication with family members. So ignore this. This is a mistake. This should have been for él and ella. So here we go. In Spanish, ella, ella tiene tos. He or she has a cough. Él o ella está bien. Él o ella tiene diabetes. Él o ella necesita medicamento. Él o ella necesita suero. He or she needs IV fluids. Very useful information. Make sure you practice it. And there you have it. I think that's it for now. Healthcare professionals, you've learned about the singular personal pronouns in Spanish. Very short, quick little video. Remember that using the correct pronoun is crucial for clear and respectful communication in medical contexts. So I hope you found this video helpful for your language learning journey. If you enjoyed it, don't forget to give me a thumbs up and subscribe to our new channel for more practical language tips tailored for you, busy healthcare professionals like you. Thank you for watching, and until next time, hasta pronto. And please don't forget to follow me on Instagram, where I post daily word of the day and phrases of the day that you can start using on your next shift. And also follow my TikTok. Thank you very much again. Have a nice day.